Around 7 p.m. every night, he would develop a fever. He would start complaining with his legs. The fevers and the pain would be so severe that when he wake up screaming, we would all get up and we would cry with him because there was nothing we could do.
Judah's doctors thought arthritis was a possibility, but Jolene, a cancer survivor, began to suspect a much scarier possibility.
I kind of knew, I didn't want to know.
After multiple trips to doctors and hospitals got her nowhere, Jolene received a critical piece of advice.
The emergency room doctor explained to me, that he knew that Judah was in pain, even though he couldn't see what it was. So he sent me here. He just told me don't stop until I get to the Memorial Hospital and take Judah to the Children's Center here.
He had been referred in because of abnormal blood counts and just generally feeling poorly.
At the Children's Hospital, they met Dr. Martin Johnston, who knew what they were facing, both medically and emotionally.
When a family first comes in, for them, it's devastating. They hear the word leukemia, they know leukemia is bad, most people know it's a type of cancer. Most people's experiences with cancer are not good, so they hear the word cancer and they think, my child's going to die.
I just screamed and I buried my head in the pillow and I, just not my son. And when I looked up from the pillow, Dr. Johnston was sitting directly beside me.
As devastated as she was, Dr. Johnston gave Jolene an important prescription, a prescription for hope.
It starts out with, I think your child has cancer, I think your child has leukemia. By the end of the day, what they're hearing is, this is manageable, we can take care of this.
Live from the campus of Memorial University Medical Center, the miracle stories of Gray Harkleroad, Judah Ellis, and Kylie Harper. Plus, Sierra Eich tells her own cancer story on her iPad. And Raylyn Bagley takes us on a tour of the place where they're beating cancer. All just ahead, along with the people who make it all possible, as WTOC presents the Children's Miracle Network Telethon.
Good evening, and thank you for joining us in a location that we're not exactly used to yet. This is a place we talk about all the time, but now we are here this year.
For the first time ever, more than 20 years, we've been a part of the Children's Miracle Network and helping people here at the Children's Hospital on the beautiful campus of Memorial Health. This smile is brought to you by the Children's Hospital at Memorial Health, because it wasn't so much there on January 6th of this year, a Sunday around lunchtime when Kylie Harper got a little adventurous.
In her parents' room, supposed to be taking a nap, and climbed up the dresser.
She was back there for just a few minutes, and we heard a crash.
Unfortunately, there was a very large TV on top of the dresser that came down on her.
And it was too loud. We just knew it wasn't right.
Hit her head and shoulder, causing a severe head injury.
Ray and Charlie rushed Kylie to Irwin County Hospital near their home in Ocilla, Georgia, where Dr. Casey Connor knew Kylie would need a higher level of care.
He had done his residency here at Memorial. He remembered that, just the brain trauma and the PICU was just great here.
LifeStar flew Kylie to the Children's Hospital at Memorial to the care of Dr. Tom McKee and ICU nurse Katie Blanton.
Trauma surgeons are staffed in the hospital 24/7, 365 days a year, and they see all comers from this region of the state. And the Pediatric Intensive Care Unit is an integral part of this system because children are injured every day, day and night, all year long, and this is where they end up.
Really thought that she may not make it through the night. She had a severe head injury from right off the bat. She was giving us signs that may be too severe to make it through.
I was just on my knees on the floor in the hospital.
This doctor stood there night after night, all night with those children. Not only Kylie, but with all of them. Now I know. I've seen these signs before. I have given change, but now I promise you one thing, I won't ever overlook them again.
At 23 pounds and completely full of life, you wouldn't imagine the twisted path Gray Harkleroad traveled into the world.
As any couple, we were expecting to have a easy, wonderful pregnancy, and we were real excited about having Gray. And one day she said, "We're having a little bit of complications, I'm not sure what it is."
It was on a visit to Dr. Royek that Jenna discovered Gray wasn't getting the nutrients he needed.
Yeah, she was measuring the placenta, how much nutrients again, and it was basically hardly any.
It's like, what does this mean? Well, it means your wife's going in the hospital today.
Gray was born at 31 weeks into the waiting arms of Jenna, Marion, and the Children's Hospital at Memorial University Medical Center.
He came out, and we were so scared because, they said, his rib cage is going to be showing, and he's probably going to look like a little alien, and they pull Gray up, and, and he's just little, the size of a grapefruit, and the first words out of my mouth to my wife, I said, "He doesn't look like an alien."
And he cried.
And he cried.
2.5 pounds at birth, and soon down to scarcely more than 2.
And I stuck my finger by his hand. My fingernail was almost bigger than his whole hand.
Of it.
And that just scared me.
Tell me what kind of a difference the Children's Hospital makes for a family.
Wow, where do I start? Everything from comfort to having people like Dr. Sachs, to just making us feel like our baby is totally safe and in great hands, and we could sleep at night knowing that something bad wasn't going to go wrong and we're going to lose our baby during the night. Just gave us the comfort of just being parents.
What does it mean for you personally to be able to help in this way? I think for me it really is, it's an amazing service, and when you're talking about an extremely fragile infant, sometimes minutes make a difference in an outcome of a baby. We actually do a reunion here, and to be able to see patients that are sometimes clinging to life actually come back, and families thanking us, it really is, it really means a lot to us, and I feel like we make a difference in the families. They appreciate the care that we give them, they appreciate the services that we have, and sometimes it's the difference between them having a chair at the table or not. So it's pretty amazing.
The folks over at Whitmarsh Island at the Walmart have many miracle stories to share. Most recently, we met your nephew, Mario Smith, who was one of our miracle children for a couple of years, who's doing extremely well right now. But remind us of Mario. We've seen his story over and over again.
Yes, Mario was diagnosed with hemophilia maybe almost like 8 months after he was born. So for the first year, we're actually going to Augusta. So we were really happy when Children's Miracle Network helped with the hospital here. And actually opened the hemophilia, bloodborne illnesses wing here. So it made us very easy to have care here. He was going once a week. Every time he had a bleed, every time he had a bump, so we're well acquainted with the hospital. They were really nice, have followed him all the way through. He's a very charismatic little boy now, very active. He loves to fly, but with his illness, he has to be very careful. But they've been with him along the way. His doctors, his nurses, they all know him on first name basis. Everybody's happy to see him when he comes. And I just think he's a great representative of what Children's Miracle Network does.
And this year you all did something that was a lot of fun. Maybe you can take a look at some of that video of the balloon contest, which I thought was so creative and wonderful. Bill, tell everybody a little bit about that contest you all had.
Well, what we did was we engaged our own team right here at home at Memorial. So throughout the hospital we had a CMN balloon campaign. So for $1 we sold balloons. And so every department could participate, and we had over 18 entries throughout the hospital, and it really gave a lot of excitement to the team members to be able to participate in a meaningful way.
I've been praying for a miracle. My future is unknown. I need someone to help me. Can't do it on my own. Every day I keep on trying, not strong enough to stand. Want you here beside me. I need you to hold my hand. I can hear a voice in the wind, calling me, calling you, like an old friend. It's the miracle of you.
Add it
drum
up this
roll
year.
and raise those numbers. Starting with you, Evan. Get them up. Here we go.
Woohoo!
1,022,000. Thank you so much. More than $1 million.